Hey guys, let us learn about the anti-malarial drugs. So this anti-malarial drugs is the most frequently tested topic. In this topic you just need to remember the names of the drugs and for which condition they are used and in which condition they are contraindicated. So this is an important previous year topic also. So let us discuss the important ones. So there are like three different topics you need to learn in the anti-malaria drugs. One is the drugs that are used in pregnancy, and the second is the artemisinin based therapy, area specific therapy, and the third one is prophylaxis of malaria. So most of the questions come from these three topics from anti-malaria drugs, and you just need to know this. I'll try to complete this topic and explain it with mnemonics and stuff with 6 slides, 6 important flashcards. So let's get started now. First one is about Plasmodium falciparum, vivax and oval. There are different types of malaria parasites like Plasmodium falciparum, vivax, oval, malaria and all. So you need to remember falciparum one side and vivax and oval together. So vivax and oval together constitute vivo. Vivax and oval, vivo, and this vivax and oval have relapse stage, that is a hypnozoid stage is there. This stays dormant in the liver and it might cause relapses. Okay, so vivax and oval are involved in the relapse stage. So you use primaquine for 2 weeks for vivax and oval, or tafinaquine for one single dose is enough. So this is about vivax and oval, where you have to remember is relapse phase is seen with vivo. Whereas falciparum, there is no relapse phase since there are no hypnocytes that are stayed dormant in the liver in this cycle. So there you just need only one single dose of primaquine. Whereas for vivo, you need 2 weeks dose of primaquine. So this is just a small gist, like summary kind of thing about falciparum, vivax and oval. Now let us get into the topic proper, that is what are the drugs that are used in pregnancy. Okay, so in pregnancy, when the female is having uncomplicated malaria, okay, remember this point, the female is having uncomplicated malaria and she has presented to you in the first trimester. So what are the drugs that you prefer? So if the female is suffering from vivax and oval malaria, then you need to give chloroquine. Vivax and oval, you need to give chloroquine. Whereas falciparum is inherently resistant to chloroquine. So chloroquine does not act against P. falciparum parasite. So you need to give quinine and clindamycin in that case. So when the pregnant woman comes in first trimester, she is suffering with vivax and oval, then give chloroquine. If falciparum, then you should directly start with quinine. If the patient is resistant, to chloroquine, then shift her to quinine or plus clindamycin treatment. This is the basic thing. In vivo, I have already told you that there is a relapse phase. So for the relapse phase, you either need to do in primaquine 14 days or for tafinaquine 1 dose. The important point here is primaquine is to be contraindicated in pregnancy. Primaquine is contraindicated in pregnancy. So you should not give primaquine during the first trimester or second or third trimester. So you have to give it postpartum. After the delivery, you have to give it for 14 days, or tafinaquine for 1 dose is enough. This is regards of uncomplicated pregnancy in first trimester. When we discuss about the uncomplicated pregnancy in the second and third trimester, this depends upon the area specific artemisinin or artesunate based therapy for the falciparum. Okay, so second and third trimester is like any general population. You have to see whether it is northeastern state or the other states, and you have to follow that therapy. So that is like simple only. The complications or the more things that you need to remember are from the first trimester. And the important point is primaquine is contraindicated in pregnancy. When we discuss about the complicated malaria or severe malaria or cerebral malaria, then the drug of choice is IV artesunate. Both in pregnant females and in general population also, the drug of choice is IV artesunate. You should not like think about the damage or the side effects caused by the drug to the fetus here. You have to see that the mother's health is important here, so you have to give preference to mother. So you just give IV artesunate to save the mother from the cerebral malaria or complicated malaria. So this is about pregnancy, whether it is uncomplicated first trimester, uncomplicated second and third trimester, or it is complicated one. So this is summarized in these 2 sheets. Now let us go to the area based therapy. As discussed in the pregnancy also, in second and third trimester you have to go with area specific therapy, right? And in general population also it is area specific therapy. So what is all about this area specific therapy? So there are two different zones, northeastern like Assam, Sikkim, all that side, like Seven Sisters side. Northeastern side, you have to use lumifrantin and artemether therapy. So remember it as northern lanes, okay? Lanes, LANE. So northeastern is for LA. L is lumifrantin and A is artemether. In order not to confuse this A as artesunate, I have highlighted here me and me. Lumifrantin is artemether, me and me. So the other A is artesunate that comes for other states, okay? For other states, you need to give artesunate, sulfadoxine and pyrimethamine. So ACT SP. So you just remember one thing. Then automatically the rest will be for the other thing, right? So just remember lane. That is lumifrantin and artemether is for northeastern state, me and me. This is about area specific. You just need to remember this area specific for the pregnancy also. In the pregnancy also, you give according to the area specific therapy. Now coming to the dosages, this is actually an extra slide. Even if you forget this dosage or even if you don't remember also, that is not a big deal. But just I have got a simplified method. I have like put it in a box here. So just let us try to have a look over it. Just look for once, and even if you forget, it's not a problem. So let us deal with first one, that is Vivax, second is mixed, and third is Falciparum. Okay, so first Vivax, the drug of choice is Chloroquine. And for the relapse, Vivax has relapse, right? So you give Primaquine. Chloroquine is given as 25 mg per kg, whereas Primaquine you just put 0.25, 0.25. And it is also given like, it is divided into doses, like on day 1 you give 10, to day 2 is 10 and day 3 is 5. So overall together constitute 25 mg per kg. This is about 5x. So you give 0.25 mg Primaquine for 14 days. Coming to the mixed. In mixed also you have Falciparum, right? Mixed infection meaning Vivax, Oval, Falciparum, Malaria and all. So you have Falciparum in it. Whenever you have Falciparum involved, you divide it into northeastern and other states, okay? So northeastern is lane, right? LANE. So ACT all. And other states is ACT SP. This is for 3 days. And mixed also, same like Vivax, you just give us 0.25 mg per kg for 14 days. This is same. Coming to the Falciparum, since the name Falciparum is there, you have to divide, right? Same like above, NE and other. Same. ACT all, ACT SP, 3 days, 3 days. So ACT therapy has 3 letters, so 3 days everywhere. Whereas coming to the Primaquine here, that differs. Here it is 0.75. Above 2 are 0.25, but it is 0.75. Remember it as F. Mirror image is 7. So 0.75 mg on day 2. So this is about the dosages. I think now dosage also becomes easier for you. Even if they ask that dosage level question also, you can answer now. Now let us get into the last slide, but not the least one. So this is the most important, I can say. This is about prophylaxis of malaria. So you give prophylaxis to malaria depending on the duration of the stay, or like how many weeks the person is going to that malaria endemic zone. So duration of stay, if he is staying there for less than 6 weeks or he or she is staying for greater than 6 weeks. If the trip is for less than 6 weeks, then short-term prophylaxis. If it is for long-term, greater than 6 weeks, it is long-term prophylaxis. So for short-term prophylaxis, everything is about D, okay. So doxycycline, daily doses, there are do doses, do meaning 2 in Hindi, right? So do doses, that is 2 doses, daily doses, and for the whole stay also you should continue doxycycline, and after returning also for 4 weeks, daily you have to give doxycycline. So that is the treatment. All D's, doxycycline, daily, do doses. Coming to the long term stay, that is greater than 6 weeks, you give mefloquine. Mefloquine has LO in it, so long term is mefloquine. You can remember it as mefloquine. Just you can twist the word, right? Mefloquine, long term, LO. And you give this also for 2 doses weekly, but here it was daily, okay. Here it is weekly because like long term, right? So weekly. And for the whole stay you continue mefloquine, and after returning for 4 weeks, that is weekly doses for 4 weeks. So this is common, like 4 weeks thing is common. This is just daily doses. Here it is weekly doses. LO, meflo is long, and short term is all D's, doxy, daily. So this simple it is. Prophylaxis is also done now. So they mostly ask you questions like this only, like this drug is used in which condition, northeastern state, which drug is used in Assam. If the question mentions Assam or Sikkim, those kind of places, then they are concentrating on Falciparum. So you need to remember Assam meaning northeastern. Northeastern means lane. So what is lane? Lumifrantin and artemether. So lumi, artemether. I have got a question for you. Comment your answer in the comment section below. And guys, if you like this kind of content, please do support by liking, sharing and subscribing. And we have a Telegram group also. You can post your doubts and any topic of difficulty there. The links for which I have provided in the description below. Go check there once. Thank you.